Do you have thumb pain that makes it difficult for you to twist faucets, open jars, or twist doorknobs, grip or grasp things? This could be a condition called DeQuervain's tenosynovitis. It's an inflammation of the sheath that goes around the tendon near your thumb. It can be very, very painful. A lot of medical sites attribute DeQuervain's disease to overuse, repetitive gripping, or things like lifting up a baby because of the strain on the thumb. But what they don't mention are two very common activities that many people do hundreds of thousands of times a day. And that's using a computer keyboard and hitting the space bar with your thumb, or texting using your thumb. This activity puts the thumb in a very risky and compromised position where it can be easily injured over time. The clinical test for DeQuervain's disease is to take the fingers and wrap them around the thumb and then bend the hand down, and that will reproduce the pain. I'm not suggesting that you do that. I'm just telling you that's probably what you will do if you see the doctor and he suspects DeQuervain's disease. But some doctors get DeQuervain's disease confused with things like carpal tunnel syndrome, which is in a different area of the hand, and also intersection syndrome, which is nearby, but it's not the same thing as DeQuervain's disease. So if your doctor is suggesting surgery, I highly recommend that you get a second opinion and be aware that sometimes people are not happy with surgical outcomes, and that can lead to other problems as well. So think carefully before you have surgery. The other suggested treatments, and I say that guardedly, are things like avoiding repetitive use of the thumb. Well, this is really very difficult to do just on a daily basis because we use our thumbs for so many activities: turning faucets, driving, opening jars, many, many things. So it's very difficult to stop using your thumb. Sometimes people recommend non-steroidal anti-inflammatories. And the problem with that is that if you're masking the pain and you don't feel the pain, the injury can get worse while you're doing things because you're not aware of the pain. So that's not necessarily a good long-term solution, not to mention the side effects from non-steroidal anti-inflammatories. The other thing about thinking ahead is that what will happen if you heal from DeQuervain's disease and you go back to a job that requires a lot of repetitive thumb use, spacebar, texting, these things that people have no idea could lead to an injury. So we need some education in this department. So if you do heal somewhat and go back to work, then it's easy to get re-injured. So how has that actually solved the problem? One thing you can do that will be very helpful to you is avoid texting with your thumb. Don't scroll with your thumb. Even holding your phone can lead to thumb strain because you sort of have to use that action to hold it there. And I've done a couple of videos on the problems with cell phones and how to adapt. But if you are going to text, I recommend that you use your index finger to tap out the letters, but even better, just hit the mic and dictate or activate voice control if you have an iPhone. And then you can just talk to your phone. It listens all the time and it will save you a lot of thumb use. But getting back to the point here of preventing DeQuervain's disease, this isn't necessarily so easy because so many jobs require repetitive thumb use, repetitive gripping, repetitive hand use. So what we really need to do is go to the source of the problem, which can be the way work itself is designed, putting all the work on the hands instead of using more of a whole body, healthier approach to work, and the shape of the tools themselves. Cell phones are not designed for the human hand. They can lead to injuries all by themselves, and they tend to put people in awkward neck positions, which can lead to a cascade of injuries down the upper extremity. So we really need to look at tool design, work design, and education. There is something that we can do about this as consumers. I have written a repetitive strain injury patient bill of rights, and I've posted it on change.org. And in that patient bill of rights, I've outlined all the things that lead to RSI, including ignorance. People have never heard of it until they get diagnosed in their doctor's office. And then sometimes the doctors themselves have no idea how to diagnose and treat repetitive strain injury, and that leads to further delays, more injury, and more serious complications, and the risk of people not being able to work. So if you care about your hands, or if you care about somebody else's hands, please go to change.org. I'll leave the link in the details below, and sign the petition so that we can really take some action to really do something about preventing RSI, because people don't know, they haven't been told that these things are dangerous, and they really need to know. So until next time, take good care of your hands. Remember, you can't use your other pair of hands to do what you want to do, so take care of the ones that you have, and we'll see you next time. Be sure to watch the video that's coming up next for more information about repetitive strain injury.